Hello and welcome to Startup Champions 2.0, the show where you meet and learn from National Startup Award winning founders. In today's episode, you will meet two startup champions from the health and wellness industry. They are Leucine Rich Bio and Atra Innovation. Imagine a world where we transform sick care to health care. Remember COVID? Everyone suddenly got more concerned about their immunity. But how do you track immunity? Our startup champion is creating a world where we focus on prevention than curing a disease. A world where we have more health and less disease. All of this is possible when we understand the microbiome of the human body, whether the gut, oral, skin, vaginal, or even the external ecosystem affecting the body. Scientific study says if you take care of your gut, you create a healthier body. Imagine if you were to get prebiotic, probiotic, and food recommendations based on your gut microbiome, and a lot more. Let's now see the Leucine Rich Bio story.
The microbiome is all the microbes that are living in or on our body, and we have more microbes in our gut than all human cells put together. If you're craving for ice cream right now, it's probably a bacteria in your gut signaling to your brain saying that please feed me ice cream. So this is relatively new science, but we had very early exposure to this science. I mean, through our work interest as well as staying in touch with the scientific community, and we thought this was a great way to tackle diseases, especially the kind of lifestyle diseases that we see right now. We're the only company in India offering a gut microbiome. We've started off with Make in India, Make for India. So both our test profiling package as well as the probiotics that we have now launched is a product that is made for India. It's based on Indian population data. From day one, our vision has been to change the paradigm shift in healthcare. Move it from sick care to healthcare. Can we help individuals stay healthy instead of curing them after they fall ill? That is what we want to take to consumers across India and around the world.
So Kumar and Devajyoti, welcome to Startup Champions 2.0.
Thank you.
You are South Asia's first microbiome company, right? This is amazing and congratulations to the both of you.
Thank you.
But tell me the most important thing now. These products that are kept right here on my desk, what are they and how do they actually create value for the consumers? So I'll hand it over to you, to the both of you. Please explain to our viewers what exactly are these.
Thank you, Pradipar. So this is BugSpeaks.
Okay.
It's a gut microbiome profiling test kit. So what we do is using the fecal sample of an individual, we collect that.
Okay.
And through that we measure what are the bacteria, fungus, virus residing in the gut. And through that we are able to tell the consumer whether he or she is suffering from a certain disease, how to correct it just by nutrition or taking some probiotic supplements, and get a better healthy lifestyle.
It's that simple?
We have made it that simple.
Wow, that's incredible. So, let's say our customer sort of sends you their sample across. Do they send it to your lab and then you do all the tests over it?
Yes. So what we do is we take care of the end-to-end solution. So we ship the kit to the customer's house. Once the sample is collected, we get it shipped back to our lab.
Wow.
And then we do all the processing over there.
And then, of course, the report is sent back to the customer, telling them not just about potential diseases, but actually the prebiotics or the probiotics and all the various foods, the supplements and nutritions that they should take.
Yes. So currently we're reporting at about 180 food items, and we're telling them whether to avoid it, eat it more, and basically what the bacteria wants in the gut.
Very interesting. So on that note, tell me something. What exactly is a microbiome?
So the microbiome is, it constitutes of all the microorganisms that are living in or on our body. Okay. And in the gut, 90% of all the microbes that are there are present in our gut. And if you look at it, we have more microbial cells in our body than human cells. So imagine it can dictate a lot of our health and wellness.
I'm sure. So you have consumable products like supplements. Also, you have Meta-Rich, which is a data platform for researchers and industry personnel. Please expand on both the areas of your company.
So let me take it forward from there. So this is the second product that we have. This is called Rich Bio. Now this is based on the Indian gut microbiota data.
Okay.
So whenever you go out to the shop to buy a probiotic, you would mostly buy a probiotic which was developed in the US and for
Largely.
their for their kind of gut.
Sure.
But we didn't have an Indian gut specific product.
Okay.
So since we were doing a lot of gut microbiome tests, we had a lot of Indian data, and then we figured out that there are a lot of probiotics that are missing in the Indian gut. So we thought, why don't we make a product for Indians, for their gut?
And how different fundamentally is it, the Indian gut and let's say the American gut?
So we do see a lot of differences,
Wow.
with respect to the Indian gut as opposed to the American gut. Any other geography. I mean, it's mostly got to do with our environment, the food that we eat, our early childhood exposure to the environment. All of that makes a huge difference.
Wow, phenomenal. My next question to the both of you is, I really want to talk numbers with you, right? So what kind of data set do you already have of, let's say, Indian, microbiomes, especially, in this country, of course, and also, once somebody starts consuming the products that you are recommending them, what changes for them?
Right. So we have been functioning on this line for the last 2-3 years. The pioneers in this domain.
Sure.
So we have right now close to 1,500 Indian gut microbiome data covering various diseases, because mostly people with certain disease would take this test.
Sure.
Right? And the spectrum of disease that we are looking at starts from functional gastrointestinal diseases, which includes IBD, IBS, constipation. Those are gastrointestinal diseases. To your skin disorders and type 2 diabetes, chronic diseases like type 2 diabetes, hypertension, and even NFLD and so on and so forth. So the spectrum is quite wide because gut microbiota affects a lot of medical faculties or your entire health, so to speak. And we possess India's largest shotgun metagenomics data of Indian gut.
Wow.
Which basically means that we have data of all the microorganisms present in the gut of an individual.
Okay.
So that's called shotgun metagenomics data.
Okay.
A lot of people used to sequence only bacteria.
Sure.
But we took a very strategic decision of sequencing all the microorganisms in the gut.
Phenomenal. Which for a normal person to sort of really understand, or for somebody like me to understand really, is the fact that for the Indian gut, since you've been able to map this entire data set, so now you can fundamentally predict or also find many more kinds of diseases that might be inside my body.
So it's not fundamentally finding about diseases, it's about what is your current state of the gut.
Aha.
The more diverse the microorganisms in your body, the better your health would be.
Got it.
So when people tend to have less diversity of microorganisms, that's when they suffer from a chronic disease.
Very interesting. My next question is, what's your business model? How do you guys make money?
So it's a B2B2C business model.
Okay.
So it's usually referred by nutritionists, doctors, wellness coaches, and we have a small percentage of individuals directly coming on our website and booking tests.
Oh, okay. And how did you fund this business right on day one? And have you raised any external funding till date?
When we started off, we did a lot of consultancy services. People would send us a lot of microbiome data from US, Europe.
Okay.
We'd analyze them, give back the results, get feedback from them saying what we've done, whether it's right or wrong, iteratively improved our algorithms. And that's how we self-funded the company early on. In 2017, a couple of great individuals kind of saw what we were doing and really loved where we're taking this, and that's when we got our seed round. We're in the process of raising our Series A right now.
Phenomenal. Many congratulations to you on that.
Thank you.
Thank you.
Great. Millions of Indians are watching you right now on the Startup Champions 2.0 show. They want to be successful entrepreneurs like you, but probably they don't have the right direction. What's your message to all of them?
I would say if you believe in something, if you think you're solving something, just go ahead and try and put that into action. Don't sit on a drawing paper for too long, because action speaks results.
So you got all the lessons correct. Now is the time to understand the top 2 lessons of this session. Number 1, India will be the most populated country in the world very, very soon. Studying and creating solutions for preventive healthcare are extremely critical. Number 2, pre and probiotics have a massive consumer market in India. But for that to happen and for you to be successful in that, you will have to have a data set exactly like these guys. It's time for a very, very short break. Don't go anywhere. On the other